Hello students, I am Dr. C. Bharath, Associate Professor, Department of Public Health Dentistry, Vinayak Mission Sankaracharya Dental College. I am going to present my topic title, Topical Fluorides. These are lesson plan. I am going to talk about topical fluorides, various types of topical fluorides, knowledge about topical fluorides, the application and the different clinical steps in topical fluoride application. These are my topic learning outcomes. These are my contents. Coming to introduction, topical fluorides are those delivery systems which provide fluoride for a local chemical reaction to the exposed surface of the erupted dentition. So, nothing but it is a topical application on the exposed tooth surfaces, mainly for the prevention of dental caries. So, what are the indications of this topical fluoride application? The indications are the caries active individuals, for children who shortly after the period of tooth eruption, patients on systemic illnesses or those receiving any radiations after any periodontal therapy where the roots are exposed, for mentally and physically challenged individuals. So, basically the topical fluoride application is classified into two types, that is professionally applied and self applied fluorides. So, what is professionally applied fluorides? Professionally applied fluorides is nothing but any fluoride that is applied by the professional or the dentist in the clinical setup, that is known as a professional applied application of fluorides, whereas self applied fluorides are nothing but those that are given to the patients, that is known as self applied fluorides. So, this professionally applied fluorides are usually of a higher concentration of about 5000 to 19000 ppm, whereas the self applied fluorides are always of a less fluoride concentration, that is the ppm of fluoride level in the topical fluoride application is less when compared to the professionally applied fluorides. So, this have low fluoride concentration is about 200 to 1000 ppm of fluoride. So, the professionally applied fluoride divided into three types, that is sodium fluoride, stannous fluoride and acylated phosphate fluoride, whereas self applied fluorides are nothing but your toothpastes, that is your dentifrices, mouth rinses, gels and chewing gums. So, let us see in detail about professional applied fluorides. So, what are these professional applied fluorides? Professional applied fluorides are nothing but any fluoride that is given on the at the clinical setting for the patients. So, under the supervision of the dentist, if it is done, it is known as a professionally applied topical fluoride. Under that professionally applied topical fluoride, it is the first type is known as a neutral sodium fluoride or 2% of neutral sodium fluoride. So, it was the first topical fluoride application that was practiced, and it contains about 9200 ppm of fluoride. The method of preparation of this 2% of sodium fluoride solution is prepared by dissolving 20 grams of sodium fluoride in powder in 1 liter of distilled water. It should be stored in the plastic containers. So, if it is stored in the glass containers, the fluoride will react with the glass particles and it will reduce the absorption. So, it should always be stored in the plastic containers. The recommended age groups are 3, 7, 11 and 13 years age group. So, there are 4 applications for each patient. So, minimum of 4 applications of topical fluoride is required to have a reduction of about 40% in dental caries lesions. So, method of application is known as the Knudsen's technique. So, what is a Knudsen's technique? Knudsen's technique is known as the method of application for neutral sodium fluoride, that is 2% of neutral sodium fluoride. So, the first step is to clean and polish the tooth surface thoroughly. Then the upper and lower quadrants are isolated with cotton rolls. The tooth is dried thoroughly and neutral sodium fluoride is applied with cotton applicators and allowed to dry for next 4 minutes. The procedure is again repeated for the remaining quadrants. So, the first quadrant is completely isolated, then thoroughly dried. After that, the topical fluoride is applied on the tooth surface. Next, the second quadrant is applied. So, like this the 4 quadrants are applied. So, the procedure is again repeated for the remaining quadrants and the patient is instructed not to drink or eat anything for the next 30 minutes. Why? It is because the absorption of this topical fluoride on the tooth surface is more in the first 30 minutes of application. So, that is why we ask the patient to avoid drinking or eating any foods. So, here the second, third and fourth applications are given at weekly intervals of time. So, this is a 4 application. So, every week the applications are repeated. So, mechanism of action of this sodium fluoride is the sodium fluoride reacts with hydroxyapatite crystals on the tooth surface to form calcium fluoride. So, this calcium fluoride will have an increased amount of fluoride where it can help in prevention of dental caries. The advantages of this is it is a relatively stable when kept in a plastic container and taste is well accepted and tolerated. It is non-irritating to the gingival surfaces and does not cause any discoloration of the tooth structure. The disadvantages are that the patient must make 4 visits within a relatively short period of time. So, that is a disadvantage of this neutral sodium fluoride application. Coming to next one, that is stannous fluoride. Stannous fluoride contains about 19,500 ppm of fluoride at pH of 2.4 to 2.8. It is known as a Muller's solution. So, again the oral prophylaxis has to be done, the tooth should be dried thoroughly, and then the topical fluoride is applied with cotton applicators and kept for dry for about 4 minutes. The patient is instructed not to eat or drink anything for the next 30 minutes to avoid contact with the tooth surface. So, this have a greater reduction in the dental caries incidence when compared to the sodium fluoride mouth rinses. The recommended frequency is about twice a year. So, when compared to sodium fluoride mouth rinses, the stannous fluoride mouth rinses or topical fluoride agents have only 2 applications. So, here the calcium fluoride is formed on the tooth surface. So, it reacts with the hydroxyapatite crystals and some small fraction of fluorapatite also gets formed. So, it inhibits the microorganisms that are responsible for caries action. The advantages are it is a twice a year application, and disadvantages it is unstable material. So, what is the disadvantage of this stannous fluoride is that it has to be freshly prepared each time. So, it cannot be stored in a plastic containers. So, that is a major disadvantage of this stannous fluoride application. So, it is a astringent and has disagreeable taste. So, the taste is not suitable for the children, and it is an astringent, that is it causes irritation to the gingival surfaces, and it also causes light brown discoloration of the tooth surfaces. So, that is why it is not most commonly used. The next topical fluoride which was implemented was acidified phosphate fluoride or APF gel, that is at 1.23% of APF. It contains about 12,300 ppm of fluoride, and the method of preparation is that 20 gram of sodium fluoride reacts with the hydrofluoric acid. So, it forms 1.23% of fluoride concentration. So, it is available as gels. So, the method of application is always easy for the children because it is available in it can be applied using foam trays. So, foam trays can be used for this application. So, method of application is known as a tray technique. So, we use a tray technique wherein we load the topical fluoride onto the foam trays and then apply it on the tooth surface and then wait for next 4 minutes for reaction. So, mechanism of action is that it leads to dehydration and shrinkage in the volume of the hydroxyapatite crystals. So, it reacts with the dicalcium phosphate dihydride and reacts with the fluoride that is present on the topical fluoride. So, it forms fluorapatite. So, the fluorapatite that is formed is very helpful in the prevention of dental caries. Why? Because this topical fluoride has fluoride agents. So, it helps in prevention of dental caries, that is increase in the enamel resistance of the tooth surface. So, advantages of this APF gel is that it requires only 2 applications in a year, does not have any astringent or any disagreeable taste. So, it is always accepted by all the patients. It is more stable and need not be prepared freshly. So, that is also an advantage of this particular APF gel, and it penetrates to a deeper depth than the sodium fluoride or the stannous fluoride application, because the fluorapatite that is formed reacts with the hydroxyapatite crystals and it prevents the occurrence of dental caries by increased enamel resistance of the tooth surface. Disadvantages of that, it is acidic, sour and bitter in taste, but some children do not accept this particular application. Next, the most commonly used is a fluoride varnish. So, now we saw about what is sodium fluoride, what is stannous fluoride and what is APF. Sodium fluoride is 2% sodium fluoride, neutral sodium fluoride, stannous fluoride is 8% and APF gel is 1.23%. APF gel is the most commonly used topical fluoride application because it is available as in a gel form. Method of application is the tray technique. So, the gel can be loaded into the patient's mouth. So, it is most commonly used topical fluoride application. Next, professional applied topical fluoride is the fluoride varnishes. Fluoride varnishes also have topical fluoride effect on the tooth surface. How? It is because the fluoride application onto the tooth surface, it helps in prevention of dental caries. The most commonly used are Durafet and Fluor Protector. So, the method of application is again oral prophylaxis has to be done. The tooth should be isolated with cotton rolls and dried thoroughly. Then the topical fluoride is applied onto the tooth surface on each of the tooth surfaces in a quadrant wise, and then patient is asked to keep the mouth open for the next 4 minutes. Patient is also instructed not to rinse or drink anything for the next 1 hour. So, this will have a topical application or topical effect on the tooth surface. So, method of application or mechanism of action of this topical fluoride agent is that it has a reservoir of fluoride onto the tooth surface. So, reacts with the hydroxyapatite crystals and form fluoroapatite crystals. So, it penetrates deeper into the tooth surface because it is a topical fluoride application. It penetrates deep into the tooth surface, and the fluoroapatite that is formed, it helps in prevention of dental caries. Advantages are that it has prolonged contact, therefore a deeper penetration. Isolation is not a problem for this particular topical fluoride application. Disadvantages are that longer duration of restriction post application is required because the varnishes usually it takes long time to set. So, that is why it is a disadvantage. Till now we saw about what is professional applied topical fluorides. Now we will see what is self applied fluorides. Self applied fluorides are nothing but anything that is given to the patient for application. Under the self applied fluorides, the first one is known as a dentrifies. That is, it is from the Latin word that is dens or tooth and frica, that is to rub. The first attempt for this topical dentrifies was given by BB, where he used the dentrifies for the patients. First fluoride dentrifies was accepted by ADA in 1964. The most commonly used dentrifies are sodium fluoride, that is neutral sodium fluoride, sodium monofluorophosphate. For children we use a pea-sized toothpaste, whereas for adults we use a bigger quantity of toothpaste. So, this is a recommendation for the topical fluoride application for children, that is for below 4 years we use a fluoride toothpaste, that is not recommended. 4 to 6 years brushing once daily with fluoridated toothpaste or a non-fluoridated toothpaste. 6 to 12 years we advise for brushing twice daily with fluoridated toothpaste and once with non-fluoridated toothpaste. About 12 years for brushing 3 times with fluoridated toothpaste. Next comes the fluoride mouth rinses. So, what are these mouth rinses? Mouth rinses again a topical fluoride application. So, this mouth rinses have better action when compared to a dentrifies. Why? Because it has action on the tooth surface, that is mostly the proximal tooth surfaces are involved in the mouth rinses. So, that is why it has more effectiveness and efficacy when compared to other type of self applied fluorides. So, it is an effective and economical way of caries prevention and provides topical effect with some systemic effect. So, those who are excluded are the children under 6 years of age and those who cannot rinse because of orofacial problems or due to handicap. So, the method of preparation is that it dissolve 200 milligram of fluoride, sodium fluoride tablets in 5 teaspoon of fresh clean water, and ask the members to use this particular mouth rinses for about 4 members in a family. 10 ml per rinse and swish for about 60 seconds and then to expectorate the contents. The frequency of rinsing is about once a day, once a week or once in every 2 weeks. So, when compared to other agents, this fluoride mouth rinses are more effective in topical fluoride application. The other types of topical fluoride agents are your fluoride chewing gums. So, chewing gums can be given to the children and adults. It has again a topical fluoride effect. Fluoride implicated dental floss and toothpicks are also there, wherein we use the dental floss and toothpicks on the mainly the interdental surfaces. So, the interdental caries or any proximal caries, if it is there, we advise for this fluoride implicated dental flosses and toothpicks. The recent advances in this topical fluoride agents are your controlled fluoride releasing agents or controlled release of fluoride. It was first devised by Kausar et al. In 1976. It was developed as an intraoral fluoride releasing device. So, what are these intraoral fluoride releasing devices? These intraoral fluoride releasing devices are fixed onto the molar tooth surfaces of the upper or the lower teeth. So, it has continuous release of this fluoride into the oral cavity. So, it releases about 0.02 to 1 milligram per day for about 6 months. So, device is incorporated into the space maintenance or even onto the partial dentures. Even the crowns and bridges can be irrigated with this controlled release fluorides. Orthodontic appliances can be given using this particular method. Again, it has a benefit effect on the patients with xerostomia, that is patients with decreased salivary, those patients we can advise for this fluoride application. The last part is your fluoride releasing dental materials. So, what are these fluoride releasing dental materials? The recent advantages of this particular fluoride agents are nothing but the fluoride is incorporated into the dental materials. So, what are these dental materials? The silver amalgams, which contain about stannous fluoride or calcium fluoride, the glass ionomous cements, zinc phosphate cements, which is integrated with sodium fluoride and stannous fluoride mouth rinses. Fluoride releasing resin composites and sealants are also there, wherein the sealants are applied onto the tooth surface for the pit and fissure caries. So, when the sealant have this fluoride onto the tooth surface, it has a topical effect. Fluoride containing alginates are also available. So, artificial saliva is also implemented with topical fluoride agents, that is sodium fluoride or gels. So, the advantage of this particular technique is that it has a slow and sustained release of fluoride onto the tooth surface. So, it helps in prevention of secondary caries, and fluoride reserves can be replaced by topical therapy, especially the fluoride varnishes. So, these are the recent advances wherein the fluoride is integrated into the dental materials, so that it has a constant prevention of dental caries. Last is your multiple fluoride therapy. So, what is this multiple fluoride therapy? There is no particular technique, no particular fluoride treatment which provides total protection to the tooth surface. So, multiple fluoride therapy is nothing but we combine all the methods, all the different fluoride delivery methods for implementing the prevention of dental caries. So, what is this multiple fluoride therapies? It is an implementation of multiple fluoride components, that is fluoride containing prophylactic paste, topical fluoride solutions and self care using fluoride dentifrices. That is, we advise for topical fluoride application, this professional applied topical fluoride application. Prophylactic paste is also given to the patients, and also the fluoride is also given to the patient like using your dentifrices. All these are known as multiple fluoride therapies, that is, we use multiple fluoride components for the prevention of dental caries. To conclude, the primary caries preventive effect of fluoride result from the topical contact with the enamel and through the antibacterial actions. The fluoride continues to be the cornerstone in the prevention of dental caries throughout the world and through a variety of sources of fluoride which may contribute to the dietary intake of fluoride. These are my references. Thank you everyone for watching my class.